Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in nursing competitive exam as well as IELTS and CLEX and OET training. Today we are going to discuss about a topic which is from nursing foundation, and definitely there will be a question in the examination related to this topic. Okay, so nursing foundation means legal aspect and the models of nursing care. Definitely from these topic questions will be there. Okay, so most of the students are having confusion in these topics only. See, in this topic we are going to discuss about primary nursing care, case management, so on. Okay, so please watch the video till the end. Definitely it will be so much useful for you, and I'm sure that definitely there will be a question from this topic. So watch the video till the end, and before going for the examination, just watch the video once again. It will be act as a revision. Okay, let's begin the session without wasting the time. So nursing foundation, the topic what we are going to discuss is models of nursing care. And one thing I would like to say here, if you like this video, please like it, share it, and subscribe the channel. Many viewers are watching the video without subscribing. Please subscribe the channel. It will be acting as a motivation for us. Okay, so if you like the video, please like it, share it, and subscribe the channel. Okay, so let's begin the session. So the first question is the responsibility of the nurse in primary nursing care model. Okay, so many models we are going to discuss one by one in detail. Please understand the concept. Okay, and if you have any doubt, you can drop your message in the comment section also. So the first question is the responsibility of the nurse in the primary nursing care model. Here directly they are asking about the responsibility of primary nursing care model. Okay, so they have given four options like assisting in work of team leader, working as a team leader, providing care to patient or a group of patient for a period of time, providing care to the patient or a group of patient during assigned shift. Okay, see, please understand the concept. One key point is there. Always remember, primary nursing care model means immediately you have to think about a nurse who is giving the care continuously for 24 hours till the patient is getting discharged. So this is the key point you're supposed to remember. Once again, I will repeat, please listen carefully. It is also mentioned here. For this question, the right answer is option C. Okay, that is providing care to the patient or a group of patient for a period of time. For a period of time. What is the period of time? From the admission till the discharge, the planning of the care, each and everything, collaborating with the patient, collaborating with the family members of the patient, collaborating with other team members, each and everything is done by the nurse only. Okay, so this is called as what? Primary nursing care model. In the description also it is very clearly mentioned. You can see the third point. Okay, in the third point it is mentioned that this method is based on the concept of my patient, my nurse. My patient, my nurse. If this key point is present, means immediately you have to think about what? Nursing. That is primary nursing care model. Okay, so in this nursing care delivery system, each registered nurse is assigned to carry a group of patient for which she planned complete 24 hours care. Okay, complete 24 hours care she has to plan, whether she is in duty or not, doesn't matter. For example, morning the nurse is in the duty and she is planning the care for 24 hours. So 6 hours the nurse will be doing the duty. After that she is going home, and again the next 6 hours another nurse will come, right? So first morning shift, the nurse, she has to plan the 24 hours care and she has to hand over the 24 hours care to the evening duty nurse also, second shift nurse also. Okay, and the second shift nurse, she has to hand over to the last duty nurse. So morning duty nurse has to plan the care for continuous 24 hours until she is coming back to the duty. ஒரு நர்ஸ் இருக்காங்க, அவங்க கிட்ட வந்து 24 ஹவர்ஸ் கேர் வந்து ப்ரிப்பேர் பண்ணணும். அந்த நர்ஸ் வந்து அந்த பேஷண்ட்டுக்கு 24 ஹவர்ஸ் கேர் வந்து மார்னிங் ஷிஃப்ட்லேயே வந்து ரெடி பண்ணிடுவாங்க. ஈவினிங் ஷிஃப்ட் நர்ஸ் கிட்ட வந்து அதை ஹேண்ட் ஓவர் பண்ணிட்டு போவாங்க. ஸோ மார்னிங் டியூட்டியில் இருக்கிற நர்ஸ் ஈவினிங் டியூட்டியும் வந்து கொலாபரேட் பண்ணணும், நைட் டியூட்டி சிஸ்டர் கிட்டையும் வந்து கொலாபரேட் பண்ணணும். ஸோ 24 ஹவர்ஸ் கண்டினியூஸாக இவங்க தான் வந்து டேக் ஓவர் பண்ணணும். ஓகேவா? எது வரைக்கும்? பேஷண்ட் வந்து டிஸ்சார்ஜ் ஆகிற வரைக்கும். ஸோ இந்த கான்செப்ட் வந்து உங்ககிட்ட எப்பயுமே ஞாபகத்தில் இருக்கணும். ஸோ பிரைமரி நர்சிங் கேர் மாடல் இன் த சென்ஸ் 24 hours care till the patient is getting discharged. Please understand this concept. Okay, mostly you will be getting confused with primary nursing care and case method. Okay, we'll be discussing about that. But primary nursing care means this is the concept: 24 hours till the discharge of the patient. These 2 points please keep in mind. So the next one is Yes. Model. See, understanding the model is also very, very important. In some exam, they will be giving the picture like this. Okay, the model like this, and they will be asking what model is this. Okay, so it is a team nursing model, primary nursing model, or case management. What model is this? So for understanding this, you have to capture the image whatever I'm given here. Very important point, guys. See here, I'm going to explain you about the primary nurse. Already I have given adequate explanation about the primary nurse. Once again, I'm going to explain about the model. See, this is the primary nurse. She has to give 24-hour care for the patient. Okay, so the primary nurse is going to communicate with the in charge nurse, communicate with the physician and other healthcare worker, communicate with the other duty sisters. Okay, so the primary nurse is the whole responsible for each and everything till the discharge of the patient. That is what I want to say. Okay, so this is the model of what? Primary nursing care. Okay, so the next question is, the nurse collaborate directly with the client to establish and implement a plan of care is there. Once again, I will repeat. First, understand the key point. The nurse collaborate directly with the client. The nurse is not collaborating with the other team members. First, the priority thing is the nurse is collaborating directly with the patient or the client family members in order to implement the plan of care. If you are getting this kind of question, the key points are the nurse collaborating directly with the client. This is the key point. Definitely you have to think about what? Primary nurse. Okay, the nurse collaborate directly with the client. This is the keyword, directly with the client. Okay, so if this keyword is present, means you have to think about what? Primary nurse. Understand, guys? So here the right answer is what? Primary nurse. I have told the keyword also, nurse collaborating directly with the client. Okay, so the next question is, collaboration in providing care to a group of patients under the direction of a professional nurse. Underline the keyword, under the direction of the professional nurse. This is the key point. This is the key point. Under the direction of a professional nurse, you are collaborating with other team members also in order to give the care. So this is the question you're supposed to understand. Okay, so I have tell the keywords also, direction of the professional nurse. So if this word is coming, means immediately you have to think about what? Team method. So which is the right answer here? Option D, that is team method. So why I have selected this option? Let me show the model so that it will be easy for you to understand. Okay, so here you can see the model. See, always remember, guys, team nursing means one in charge will be there. One charge nurse will be there. You can see in the top, a charge nurse will be there. Okay, definitely she is going to be a registered nurse. So the charge nurse is going to select one registered nurse, and the registered nurse is going to plan the care of the patient, and the registered nurse is going to assign the duties to other nurse. Once again, I will repeat in Tamil. ஒரு சார்ஜ் நர்ஸ் வந்து இருப்பாங்க. ஓகேங்களா, அவங்களை வந்து நீங்க சூப்பர்வைசர் வச்சுக்கலாம், இல்ல இன்சார்ஜ் நர்ஸ்னு வச்சுக்கலாம், என்ன வேணா வச்சுக்கலாம். ஸோ ஒரு ரெஸ்பான்சிபிள் பர்சன், அதாவது ஒரு சார்ஜ் நர்ஸ் வந்து இருப்பாங்க. அவங்க ரிஜிஸ்டர் நர்ஸா இருப்பாங்க. அவங்க ஒரு ரிஜிஸ்டர் நர்ஸ் இன்னொரு ரிஜிஸ்டர் நர்ஸை வந்து செலக்ட் பண்ணுவாங்க. ஒரு சார்ஜ் நர்ஸ் ஒரு ரிஜிஸ்டர் நர்ஸை வந்து செலக்ட் பண்ணுவாங்க. ஒரு சீனியர் நர்ஸ் ஒரு நியூவா ஜாயின் பண்ண ஒரு நர்ஸை வந்து செலக்ட் பண்றாங்கன்னு வைங்களேன். நியூவா மீன்ஸ் ஒரு எக்ஸ்பீரியன்ஸ், ஒரு 1 year எக்ஸ்பீரியன்ஸ் இருக்கு, அந்த நர்ஸை வந்து செலக்ட் பண்றாங்க. அவங்க கிட்ட ஒரு குரூப் ஆஃப் பேஷண்ட்ஸை வந்து கொடுக்குறாங்க. ஸோ அந்த ரிஜிஸ்டர்ட் நர்ஸ், அந்த சார்ஜ் நர்ஸ் செலக்ட் பண்ண அந்த ரிஜிஸ்டர்ட் நர்ஸ் தான் பாத்தீங்க அப்படின்னா டீம் லீடரா வந்து ஆக்ட் பண்ண போறாங்க. ஃபார் எக்ஸாம்பிள், நான் வந்து ஒரு சார்ஜ் நர்ஸ்னு வச்சுக்கோங்களேன். இப்போ நீங்க பாத்துட்டு இருக்கீங்க, நீங்க தான் வந்து ஒரு ரிஜிஸ்டர்ட் நர்ஸ். ஓகே, ஸோ உங்களுக்கு அடிக்குவேட்டான ஒரு எக்ஸ்பீரியன்ஸ் இருக்கு. நான் வந்து உங்ககிட்ட வந்து ஒரு குரூப் ஆஃப் பேஷண்ட்ஸை வந்து அசைன் பண்ணிட்டேன். ஸோ இப்போ நீங்க என்ன பண்றீங்க, உங்களுக்கு கீழே இருக்கிற அந்த நர்சஸை எல்லாருக்கையும் இந்த ஒர்க் நீ பண்ணணும், இந்த ஒர்க் நீ பண்ணணும், இந்த ஒர்க் நீ பண்ணணும் அப்படின்னு சொல்லிட்டு ஒர்க்கை வந்து டிவைட் பண்ணி கொடுக்குறீங்க. இட் இஸ் கால்ட் அஸ் வாட்? டீம் நர்ஸ். So here the key point is, one charge nurse will be there, and under her a registered nurse will be there. Under her a group of nurses will be there, and a registered nurse is going to assign the task to all the nurses, and they will be giving care to the patients. Okay, so this is called as what? Team nursing. What? Team nursing. Hope you understand the concept, right? So the next one is, I have classified the basic difference between the primary nursing and team nursing, guys. In primary nursing, a registered nurse is the responsible for managing and coordinating the care of a group of patients throughout the hospital stay. As I mentioned already, till the discharge of the patient, the primary nurse is going to give full care to the patient till the discharge. Team nursing means one in charge will be there, the supervisor will be there. She is going to assign one registered nurse, and the registered nurse is going to distribute the work to other nurse. Okay, so this is called as what? Team nursing. In a collaborative way, they are giving care. So the next question is, the nurse assign the total care of one or more client to a nurse in a ward. This method of assignment is known as. Direct question, the nurse assign the total care of one or more client to a nurse in a ward. One or more client. Okay, so what kind of nursing is this? They have given 4 options: case method, functional method of assignment, modular nursing, and team method. And here the right answer is option A, that is case method. So why I have selected case method? What is the rationale behind that? See, case method, it is also called as, I have mentioned here, client focused care or total care. Okay, client focused care. Mostly the students will get confused with primary nursing and case method. In primary nursing, till the discharge, 24-hour care given by the nurse. Whereas here, case method, till your shift is going to get complete. Okay, for example, 8 o'clock, I'm going to the hospital, I'm getting the handing over. From that time till 2 p.m., 6 hours. That particular patients are going to be under me, and I'm going to give full care to the patient only during my shift time. This is called as what? Case method. Only during my particular shift. I have highlighted here also. Particular one shift, I am going to plan each and every care for the patient. Okay, it is most suitable method in ICU and for the unconscious patient. Okay, guys. So this is called as what? Case method. Okay, and the next one important thing is that is modular nursing. I have explained about modular nursing also. Modular nursing is also same like team method. Okay, here also one in-charge person will be there. She is going to assign the registered nurse, and the registered nurse is going to assign the duties to all the nurses. It is going to be there. But here, how the patient are separated, that is very important. According to the geographical area, the patients are separated. For example, a group of patients, they will be in ICU. A group of patients, they will be in CCU. A group of patients, they will be in HDU. Okay, so yes, in-charge nurse or a team leader, she is going to assign the other nurses in particular ward or ICU or CCU or HDU. ஓகேங்களா? ஸோ இது வந்து இந்த மாடுலர் நர்சிங் அப்படின்னா ஒரு டீம் நர்சிங் மாதிரி தான். இதுல என்ன அப்படின்னா ஒரு ஜியாகிரபிக்கல் ஏரியாவை பேஸ் பண்ணி அவங்க டிவைட் பண்ணி வச்சிருக்காங்க. ஃபார் எக்ஸாம்பிள் ICU, CCU, HDU அப்படின்னு சொல்லி டிவைட் பண்ணி வச்சிருக்காங்க. பிகாஸ் இந்த மெத்தட் வந்து எதுக்கு ரொம்ப சூட்டபிளா இருக்கும் அப்படின்னா இந்த மாதிரி கிரிட்டிக்கல் கேர் பேஷன்ஸ்க்கு ரொம்ப சூட்டபிளா இருக்கும். ஸோ இந்த மாதிரி ஜியாகிரபிக்கல் ஏரியா வந்து பிரிச்சு வச்சிருக்காங்க. இங்க ஒரு டீம் நர்ஸ் இருப்பாங்க, ரிஜிஸ்டர்ட் நர்ஸ். அவங்க வந்து அவங்களுக்கு கீழே இருக்கிற நர்ஸை வந்து டிவைட் பண்ணி இந்த ஏரியாக்கெல்லாம் வந்து அலாட் பண்றாங்க, ஒர்க் அசைன் பண்ணி. சரியா? ஸோ இதுதான் என்னது மாடுலர் நர்சிங். டீம் நர்சிங்ல ஜியாகிரபிக்கல் ஏரியா மாதிரி பிரிச்சிருக்க மாட்டாங்க. மாடுலர் நர்சிங்ல ஜியாகிரபிக்கல் ஏரியா மாதிரி பிரிச்சு அங்க வந்து அசைன் பண்றாங்க. முடிஞ்சிச்சு. சரியா? ஸோ நெக்ஸ்ட் ஒன் இஸ் ஃபங்க்ஷனல் நர்சிங் இஸ் ஏ மெத்தட் ஆஃப் ப்ரொவைடிங். ஃபங்க்ஷனல் நர்சிங் இருக்கிறதுலயே ரொம்ப ஈஸியான மெத்தட் என்ன அப்படின்னா ஃபங்க்ஷனல் நர்சிங். ஓகே, இதுக்கு இன்னொரு பேர் இருக்கு, தட் இஸ் கால்ட் அஸ் வாட்? டாஸ்க் ஃபோக்கஸ்ட். ஓகே, டாஸ்க் ஃபோக்கஸ்ட், நாட் பேஷண்ட் ஃபோக்கஸ்ட். ஸோ டாஸ்க் ஃபோக்கஸ்ட் nursing method, if they are asking question like this, means immediately you have to go for what? Functional nursing. So in this question, it is a direct question, and they have asked functional nursing is the method of providing equipment care, care of record, case management, patient care. And here the right answer is what? Patient care. Option B is the right one, that is patient care. Functional nursing means patient care, but only the task oriented patient care. Okay, whatever the work is assigned for me. For example, the in-charge sister is saying you have to administer injection to the patient. That's all. That my work is completed. And she is calling another nurse and saying you have to maintain the cleanliness of the bedside. Okay, that is their work. She is calling another nurse and saying you have to do dressing for the patient. That's all. The work is completed. So only the particular task is given to a particular nurse, and if the work is completed, means that's all, the work is completed. Okay, this is called as what? Functional nursing or task focused nursing. ஒரு வேலை கொடுப்பாங்க, அந்த வேலை முடிஞ்சிச்சுன்னா என் வேலை முடிஞ்சிச்சு, அவ்வளவுதான். ஒவ்வொரு ஒரு 5 நர்ஸ் இருக்காங்கன்னா அந்த 5 பேருக்கும் பிரிச்சு நீ வந்து ட்ரீட்மெண்ட் பார்க்கணும், இன்ஜெக்ஷன் கொடுக்கணும், நீ வந்து டேப்லெட் கொடுக்கணும், நீ வந்து ட்ரெஸ்ஸிங் பண்ணணும், நீ வந்து பெட் மேக்கிங் பண்ணணும் அப்படின்னு சொல்லிட்டு பிரிச்சு கொடுத்துருவாங்க. அந்த ஒர்க் முடிஞ்சிச்சுன்னா அவ்வளவுதான், முடிஞ்சிருச்சு. This is called as what? Task focused, not patient focused. Okay, so this is very important question. So here also the model is there. A in charge nurse, otherwise a team leader will be there. She will be a registered nurse. Okay, and she is assigning task or work to other nurses, like medication will be given by one nurse, treatment chart will be maintained by one nurse, vital signs will be taken by another nurse, the hygiene will be maintained by one nurse. Okay, so the task is divided to each and every person, so it is called as what? Task oriented. Okay, so till now what are all the things we have discussed? We have discussed about the primary nursing care. 24 hours the nurse has to give care to the patient until the discharge of the patient. Okay, and the next one is team nursing. Team nursing, one head supervisor will be there. She will be assigning a registered nurse, and the registered nurse is going to allot the work to other nurses. Okay, that is called as what? Team nurses. Okay, and the next one is functional one. The functional one is also called as what? Task oriented. Okay, so whatever the task is assigned to you, you are going to complete it. Okay, and what else we have discussed about? What? Case management also, right? So yes, case management, one particular shift, whatever the task is given to you, you are going to complete it. Okay, you are going to give full care to the patient, but in a shift, in a particular shift. That is called as what? Case method. Okay, hope everyone understand all the topics whatever I am discussed here. If you have any doubts anywhere here, please drop your message in the comment section. And thank you very much for watching the video. And once again, I'm saying, if you like the video, please like it, share it, and subscribe the channel so that whatever the videos we are posting, it will be reaching you at the exact time. So thank you once again.